Hello everybody, I'm Dr. Dweepika Garg and welcome back to my YouTube channel. Today we would be covering the part 3 of basic properties of orthodontic arch wires. So I hope all of you have gone through the part 1 and part 2 because those two videos were of extreme importance, and in case you want to relate it with the third video, it will become very important that you go back to the previous two videos and have a look first. Okay, so hoping that you all have done it and the preparations are going on well. You all have made a timetable for yourself and gone through the previous videos. So today we would be covering the third part, wherein we would be seeing what is cyclic fatigue, sensitization, stabilization, aesthetics, biocompatibility, biohost stability, coefficient of friction, zero stress relaxation, load deflection characteristics and load deflection rate, followed by the ideal requisites of basic properties of orthodontic arch wire. And with this, we would be concluding this particular topic. So this topic, students, is extremely huge and very important. Whether you are a NEET MDS aspirant or you are an orthodontic resident, this is something which you have to be extremely thorough with. Okay, questions are always asked from this particular question, and they are like never in they're all never given to you in an easy manner. They'll be always twisted, so you have to be very thorough with the concept of it basically. Okay, so I'll try to make you people understand each and everything in depth so that you can apply it in between, in the questions. You can apply it and accordingly attempt the questions. I would recommend that if you have not seen the previous two videos of basic properties, please go through them first and then come to this video. Otherwise, there will be no link for you people. Plus, you wouldn't be able to correlate it, which is very important over here because all the basic things are covered, and this is a little on the higher side of it. Okay, these concepts are a little difficult. So in case you have gone through the previous two videos, you have understood it, it will become very easy for you people. Okay, so hoping that is done, let us start with the very first concept of cyclic fatigue. What is cyclic fatigue? See, if there is repeated cyclic stress of a magnitude below the fracture point of a wire, then fracture of the wire can occur. Okay, so again, same thing with the hope that you have seen the previous two videos. I'll be continuing this particular part. So if there is repeated cyclic stress of magnitude below the fracture point of a wire. So when I'm talking about the fracture point of the wire, the thing which should click into your mind is the stress strain curve. Okay, so this was the stress strain curve where we had proportional limit, we had elastic limit, we had yield strength, and ultimate there was a rupture point, if you people remember. Okay, so this was the rupture point. So when there is repeated cyclic stress of magnitude which is below the fracture point of a wire, then fracture of the wire can occur. Meaning, if I take a wire and I'm constantly manipulating it or generating stresses on it, okay, although it is the amount of stress which is induced is less than that of the fracture point, maybe it is at this particular level, but if I am doing it repeatedly, okay, if I keep on doing it, if the fatigue which I'm giving to the wire becomes cyclic in nature, then fracture of the wire can occur. Okay, meaning although my wire is not in the range of rupture point, it is in the range which is below the rupture point, but when I am giving constant stresses to the wire, or when the wire gets fatigued in a cyclic manner, the wire can get fractured. So this is the concept of cyclic fatigue. Okay, if you do it in one shot, this is the wire, you bend it one shot beyond the rupture point, it will automatically fracture. Okay, but you're not reaching the rupture point, you are below the rupture point, but then you're giving cyclic fatigue, you're constantly giving stress to it, or there is fatigue in a cyclic manner, then eventually it will fracture. So that is the concept of cyclic fatigue. And why does cyclic fatigue occur? It is because of cyclic stresses. Cyclic is something which is continuous, it is repeated. You keep doing that particular procedure again and again and again. Okay, so when I am constantly manipulating a wire, although it is below the rupture point, but it can still fracture because of cyclic fatigue which gets incorporated and generated within the wire. Okay, next concept. What is sensitization? See, we have stainless steel. Okay, it is commonly used in orthodontics. Even our brackets are made up of stainless steel, and so are the wires. So what was there when we had steel, and when steel was heated at a temperature of 800 to 1200 degrees Celsius, the carbon and chromium, which were the two main important constituents of steel, they used to react together. And what happened? Chromium carbide used to form on the surface of the wire. If this is the wire, I am heating it over a flame at a temperature of 800 to 1200 degrees Celsius. The carbon and chromium which is present in the wire gets accumulated onto the surface. And what is this? Chromium carbide is formed. So carbon and chromium will react together and lead to the formation of chromium carbide. Once this chromium carbide layer is formed, my wire becomes open to corrosion. Remember, the wire should not have the property of getting corroded. It shouldn't get corroded because we store it in the laboratory, we store it in our clinics, then it is inserted into the patient's mouth. Okay, so in case it has a tendency to get corroded, it cannot be placed in the patient's mouth. Okay, plus if it has a tendency to get corroded, the shelf life of our particular wire will decrease. So it is a loss not only for us but even for the patients. Okay, so that is known as sensitization. That is, on heating the wire at 800 to 1200 degrees Celsius, it becomes sensitized to corrosion. It becomes open to corrosion. Why? Because of the formation of a layer of chromium carbide. And how does it form? Because chromium and carbide, they react together and come onto the surface of the wire. Okay, so this is your MCQ question. A sensitization is caused because of question mark. First thing, formation of layer of, the layer is formed of chromium carbide. Okay, so basically the concept is wire heated for 800 to 1200 degrees Celsius leads to formation of chromium carbide and it becomes open to corrosion. Now this basically is a drawback of the wire, correct? So we cannot have anything which has a particular drawback. And with the amount of evolution that is occurring in orthodontics, with all the new revolutionary things coming up, the recent advances which are coming up, obviously this was one thing which was considered. It was taken into consideration. This was the first thing which was looked forward to correcting it. So what was done? Titanium was added along with carbon, along with chromium. The next content which was added to the steel was titanium. And the amount of titanium which was added was 6 times of carbon. So if my carbon was present in X amount, my titanium would be present in 6X amount. So what happened when titanium was added to steel? It was stabilized. It was no longer open to corrosion even if it was heated at this particular temperature of 800 to 1200 degrees Celsius. Okay, so my wire which was initially sensitized to corrosion due to formation of chromium carbide now becomes stabilized because of addition of titanium. So the constituents of my stainless steel now become chromium, carbide and titanium. So these are the contents of my stainless steel. So I hope you are clear with the concept of sensitization and stabilization. Sensitization was one thing. Okay, then evolution occurred, we came up with recent advances and the wire was stabilized by addition of titanium. This is the next MCQ question. The contents which leads to sensitization of the wire are chromium carbide. What was added into the wire to stabilize it? That was titanium. How much wire was added? It was 6 times of carbon. So that is how you get your stainless steel. Okay, so these are two very important concepts of 18/8 stainless steel, that is sensitization and stabilization. Moving on, next is aesthetics. We all know how important aesthetics is in dentistry and it is very important in orthodontics. Okay, now you all know that orthodontic treatment, when a patient is undergoing orthodontic treatment, generally this is how the patient looks intraorally. This is the most common image which you would have seen, that there are metal brackets running and a stainless steel wire running through it, or any whether it is nitinol or whatever. This assembly which is inserted into the patient's mouth is obviously not very aesthetic. Okay, from a distance you can find out, or you can make out that yes, the patient is undergoing orthodontic treatment. So again, concept of evolution. Okay, there are a lot of recent advances which are coming up in orthodontics. There are studies taking place and new things which are coming up. So what happened, then came the concept of ceramic brackets. So in this particular photograph, what you can see, ceramic brackets have been inserted into the patient's mouth. With the coming thing of ceramic brackets, when they were introduced, the aesthetic quotient of orthodontics became higher. Obviously, now if I am using ceramic brackets, but if I continue to use stainless steel wires as shown in this particular figure, the aesthetic quotient which came up by 30 degrees maybe, or 30% or maybe 50% comes down to 20%. Why? Because with these clear brackets or these ceramic brackets, I'm using a stainless steel wire. So again, what people saw, what orthodontists saw, that we tried to improve the aesthetic quotient. We introduced ceramic brackets. But if we continue to use stainless steel wire or wires which are visible, the patients are not getting that much amount of satisfaction. So what happened? We came up with the introduction of OptiFlex wires. Okay, so with ceramic brackets were introduced to increase the aesthetic quotient, where metal brackets could be discarded and ceramic brackets could be used. Next, we had to do something revolutionary in wires also, so that clear wires could be introduced which could resemble your tooth material. So therefore, we came up with the concept of OptiFlex wires. And now we have these clear bracket and clear wire, that is after doing the orthodontic treatment or during as in the progress of orthodontic treatment, this is how the patient looks. Do you see how inconspicuous? Can you actually visibly see or appreciate that the patient is undergoing orthodontic treatment in this particular figure? The answer is no, because although brackets are there, wire is there, the entire assembly is there, but the aesthetic quotient has increased. So this is also basically one property of Archwire, where there is change in content, there is change in color, so that it becomes more aesthetic. Okay, so this was all about aesthetics. Moving on, the next concept which we have is biocompatibility. The importance of this particular word or this property is understated. Okay, so you should understand, when I am placing my brackets and wires in a patient's mouth, which will remain inside the mouth for 1.5 to 2 years, because that long the orthodontic treatment goes on. That assembly has to be extremely biocompatible. The patient, it should be non-allergic. You all must have heard of latex allergy. We have those latex examination gloves, and often patients are allergic to latex. Similarly, patients are allergic to nitinol also, which is known as nitinol allergy. Okay, and where do we use nitinol in orthodontics? We use it in nitinol titanium wires, NiTi wires. They have a content of nitinol. So if my patient is allergic to nitinol, what will happen? There would be blisters, redness, swelling, and all these things would be seen. Okay, so that is something which is not desirable, because if the patient is allergic to nitinol, we cannot use nitinol, we cannot use this particular wire. Okay, so whatever things which we are we are inserting into the patient's mouth has to be extremely biocompatible and non-allergic. Plus, it should be non-toxic. It should not cause toxicity of any kind. Okay, there should not be any leakage which is toxic, because it will remain in the patient's mouth for such a long period. Okay, so how can we afford it to be toxic or allergic? No, it is not good for patient's oral health. Rather, overall health, it is not good. Okay, and the third thing is it should be resistant to corrosion. Of course, it is present in the intraoral cavity. Okay, where we have salivary fluids also. We have saliva which is acidic in nature. Okay, the pH although is maintained, but it becomes acidic. So we cannot take the risk of the material of being allergic, toxic, or not resistant to corrosion. So all the brackets, wires, e-chains, coil, whatever is there in ortho, or rather in dentistry, should be biocompatible. So one basic properties of orthodontic arch wire, which is often not very much talked about, is biocompatibility. It should not cause any allergic reactions or any toxicity in the intraoral cavity. Okay. Next thing is biohostability. That was biocompatibility. This is biohostability. What is biohostability? It is the ease with which it accumulates bacteria, spores, and virus. Okay, so if a particular material is biohostable, meaning it will accumulate bacteria, spores, and viruses. So which is not good. So this is one property which is not desirable. What we want, the material which we are using should be a poor biohost. so that it cannot accumulate bacteria and viruses. Okay, imagine if we have brackets and wires which are good biohost, meaning they have a tendency to attract bacteria, spores and viruses. What will happen? See, already in orthodontics, patient has a very difficult time in maintaining excellent oral hygiene. They're already struggling to maintain good oral hygiene, and very often we see patients with redness, swelling, gingivitis and calculus formation, eventually periodontal loss and all these things. It is very common if the patient does not maintain good oral hygiene, and we do not want to leave behind any scars in patient after the orthodontic treatment is completed. So basically we have this topic in ortho, which is scars in orthodontics, that is scars which are left behind in patient after completing the orthodontic treatment. Like we have white spot lesions. Okay, if the patient doesn't maintain good oral hygiene, after the brackets are removed, we can see white spots, which are known as white spot lesion. So students, if any one of you watching the video is an orthodontic resident, please be very thorough with this concept of WSL, that is white spot lesions. It comes under the topic of orthodontic scars. Orthodontic scars can often be asked in your even final exams or internal exams as a short note. Okay, so this is a short note question, orthodontic scars, which is mainly consisting of white spot lesions. Anyway, let us come back to biohost-ability. So biohost-ability is the ease with which a particular material can accumulate all these things. So we do not want material which are good biohost to be inserted into the patient's mouth. Therefore, we look up for materials which are a poor biohost, so that patient has absolutely no problem in maintaining good oral hygiene. And it becomes even easier for us, because if the patient maintains good oral hygiene, good orthodontic treatment can be done, tooth movement can be swift, and we can complete the treatment on time. Okay, plus there would be no scars, like no white spot lesions. And yes, so that was all about biohost-ability. Next concept, which is a little tricky, is coefficient of friction. This topic is very important from orthodontic point of view, whether you are a resident or a aspirant. Okay, see, so what is friction? Friction is resistance of movement of one material over the other. Now imagine where the brackets slide over the wire. So one material has to move over the other material. So in case they are not able to do so, in case they are not able to slide along with each other or over each other, it means there is resistance to movement. And this resistance of movement is known as friction. So friction is not one thing which is desirable. We do not want friction to occur. We want smooth gliding movement so that material can glide over each other. Okay, only if the brackets can glide over the wire easily, my tooth movement will occur smoothly. Okay, so yes, this is movement of brackets over the wires. So if there is less friction, there is better sliding. So friction is inversely proportional to sliding. We do not want friction in orthodontics, because that will ultimately hamper my sliding. And if my sliding gets hampered, my tooth movement will reduce, my orthodontic treatment time duration will increase. Okay, so just to make this concept a little more clear, I'll be discussing in brief about biomechanics in orthodontics. See, basically orthodontics is all about biomechanics. So there are two kinds of biomechanics. First is sliding and next is the loop mechanics. Sliding mechanics is also known as frictional mechanics, because a lot of friction gets generated in this. Okay, so tooth movement occurs when it overcomes the friction. Okay, so basically the amount of force applied has to overcome the friction first, so that a tooth movement can occur. Loop mechanics is known as frictionless mechanics, that is, no friction is generated. So if no friction is generated, the entire amount of force gets concentrated on tooth movement only. Okay, so these are the basics in biomechanics, where there are two kinds of technique. So I'll just quickly show you the figures of each. The first figure which you see here is that of sliding mechanics. Sliding mechanics is your frictional mechanics. What is there? See, do you see this assembly? These are the brackets. This is the wire which is running over it. Okay, and it is a case of first premolar extraction. So we have to retract the anteriors in place of the first premolar which is extracted. So either we can do it by individual canine retraction, or en masse retraction can be carried out. En masse retraction is basically canine to canine, all 6 teeth are retracted together. So what is done here, as you can see, there is a skeletal anchorage is taken. This is a temporary anchorage device placed. This is a crimpable hook or a power arm which is placed in between lateral incisor and canine, and with the help of this particular E-chain, force is applied. Okay, so since this is a temporary anchorage device, mini screw is used and there is a power arm which is running, it will lead to end mass retraction where all 6 anterior teeth will get retracted. So basically what happens, my brackets slide over the wire. Now because of the amount of friction which is generated, the amount of force applied first gets dissipated in overcoming the friction. Okay. Okay, so this was your sliding mechanics where amount of friction is more, and friction is one thing which is not really desirable. Okay, therefore we have one more mechanics. This is the loop mechanics. Okay, this is your loop mechanics which is also known as frictionless mechanics. See, do you see this T loop which is present here? Okay, so this is a continuous T loop. Okay, we have lots of kind of loops. We have T loop, we have mushroom loop, we have boot loops. Okay, and opus loop. So we have lot of loops in orthodontics. So these loops are prepared and they are inserted into the patient's mouth. Okay, so now when this loop mechanics is used, the amount of friction is reduced. So this is said to have this is said to be a frictionless mechanics. Now biomechanics in orthodontics is a topic in itself and it is extremely huge. So that is not something which we can cover this way. Plus I don't want to diverge from the main topic which we are covering. This was just to make you people understand. Because we have a property of coefficient of friction. Okay, so coefficient of friction where friction is resistance of movement of one material over the other. I just introduced you to biomechanics so that you can relate it with friction. Because when I am talking about movement of one material over the other, maybe you cannot really understand what material is moving upon what. Okay, so this is the movement of bracket over wire and friction is not desirable. So because it hampers your sliding. So biomechanics, just remember there are two mechanisms which is used in biomechanics, sliding and loop mechanics. This is their basic figure. Anyways, coming back to our properties of orthodontic arch wire, the next one which we would be covering is zero stress relaxation. What is zero stress relaxation? See, if a wire is deformed, okay, and held in a fixed position, the stress in the wire diminishes with time, but strain remains constant. So let me repeat the same thing. If you have not seen the previous two videos, I request you people to see them, only then you can easily understand all these things. Because the three words underlined here can only be understood if you have seen the previous videos. And if you have seen the previous video and you have come in here, then I am sure you can understand this. If a wire is deformed, meaning, let us plot the stress strain curve again. Okay, this is proportional limit, elastic limit, yield strength, and your rupture point. So beyond this, this is my elastic strain is the maximum thing, maximum amount of force which can be generated. Beyond that, my wire becomes deformed. It doesn't come back to its original shape, size, and position. So when a wire is deformed, so now you can imagine the amount of force which has been applied, and it is held in a fixed position. The stress in the wire, what was stress? Stress was force upon area. In the wire diminishes with time, but strain remains constant. What was strain? Strain was change in dimension divided by original dimension. Okay? Now imagine this is my wire. I deform the wire completely and I am holding it in the same position. The stress in the wire diminishes. The stress will diminish because there is no force acting per unit area. I have already deformed it and I am holding it in a fixed position. So there is no force. As a result, the stress in the wire diminishes. But strain remains constant. Obviously, strain will remain constant because my dimension of the wire has changed now. It has been deformed, dimension has changed. So the dimension cannot change again, right? So the strain remains constant. So this is my zero stress relaxation. Okay, my stress will relax, it will come down to zero with over a period of time. The stress in the wire will diminish, but my strain will remain constant. So if a wire is deformed, suppose this is a deformed wire and it is held in a fixed position, No forces are acting on it, okay? It is now being held at fixed position. There are no forces acting on it. So obviously my stress will reduce because there are no forces acting. But once the deformation has occurred, my dimension has already changed. It cannot go back to its original dimension. So the stress will remain constant. So that is the concept of zero stress relaxation. And to make sure that wires do not get deformed and good orthodontic treatment is carried out, we have a concept of constant light forces. Everybody in orthodontic will always recommend you to apply light continuous forces into the patient's mouth. No heavy forces are ever desirable. Okay. Next concept is of load deflection characteristics. See, this is one graph which you all know, that this deflection line which you can see, dotted line, like on the left hand side of this is the elastic range where my stress and strain is proportional, my wire is not deformed, it will come back to its original position and shape. But beyond a particular limit, it will behave in a plastic manner where it has been permanently deformed. Okay, so based on that concept, what is my load deflection rate? Load deflection rate, that is LDR, is equal to load divided by deflection. That is, if I apply 100 grams of load on a particular wire and there is 3 millimeters of deflection in it, 33.33 becomes my load deflection. Okay, so it is the amount of deflection per unit of load. So now the next thing, less LDR is preferred in spring and more LDR is preferred in retentive units. Now let us understand this particular concept. What is a spring? So in this figure you can see that there is an open coil spring which has been placed in between premolar and the molar. Open coil spring will always open a space and closed coil spring is used to close a particular space. It is not always that we have to close spaces in orthodontics, sometimes we even need space, so we have to open the spaces. Imagine if I am placing an open coil spring in between premolar and molar to open up this space. What happens? My open coil spring is this huge, okay? Maybe it is 10 millimeters in length. So when I have to insert it between my premolar and molar, I have to compress this spring maybe till 3 millimeters and then insert it in between the two teeth. So I have to apply some load onto the spring so that I can insert it in between two teeth. And once it is inserted in between two teeth, it tries to go back to its original position. It tries to go back to its original size, which is of 10 millimeters. So while doing that, what happens? It opens up the space as well. Okay, so which has a very high LDR, I will have to apply a large amount of load. So if I apply a large amount of load, what will happen? It will get deflected. If it is getting deflected by applying such large amount of force, it will also apply a large amount of force on the tooth, which is not desirable. Okay, because by giving large amount of forces, tooth movement do not occur. Okay, so we do not have to apply large amount of force onto the tooth surface. Therefore, LDR is preferred to be less for these strings. Now imagine I am talking about a retentive unit. Suppose there is Hawley's Hawley's appliance which has a clasp. Okay, so now Hawley's appliance with these clasps is a retentive unit, meaning they prevent any kind of tooth movement from occurring and they retain the corrections which have been already done. So obviously now the wires which are used in making such appliances should be in such a, they should be strong enough to prevent any kind of movement occurring. So in such retentive units, more LDR is preferred, meaning to deflect a retentive unit, I have to apply a large amount of load. Okay, so if when occlusal forces are acting onto the tooth surface, that much amount of load is not enough to deflect the retentive unit. So that is desirable of retentive unit. That is, it does not get deflected easily. Large amount of load has to be applied to deflect it. Okay, so that is your load deflection rate. So this concept is something which is new for you. You have not seen this earlier. Even the previous concept, load deflection, your biocompatibility, biohost stability, yes, you know it. Okay, but zero stress relaxation, LDR, all these things are new concepts. So it is very important that you people understand it properly. So LDR is the amount of load applied to deflect a particular material. Okay, so that is deflection occurring per unit of load applied. Okay, so this is how you calculate load deflection, that is load upon deflection. So this can be asked in your MCQ question. Calculate the load deflection rate when I am applying 100 grams of force to move and the wire moves by 3 millimeters, or the tooth movement is occurring by 3 millimeters. So you have to calculate the LDR. Okay, and how LDR increases or reduces in spring and retentive unit is something now which you have understood. Okay. Moving on, you all must be coming around this particular thing, ideal requisites of wires. Okay, so whether you are a dental student, you are an aspirant, or you are an orthodontic resident, whenever we are talking about wires, brackets, you will always come across, tell me the ideal requisites of this particular thing. So when you talk about ideal requisites, you come across this particular list. Now I will read out the list. I will read out each and every point, and based on our previous 3 videos, each and everything should be clear in your mind. It should be crystal clear. Okay. Wires used for active components should exert low and constant forces. We just read that light continuous forces are desirable to bring about tooth movement. Next, wires of retentive unit should be stiff. We just did that LDR should be high for retentive units. Only if they are stiff, they will not get deflected easily with less amount of force. And we do not want the wires of retentive unit to move easily. Otherwise, they will not be able to retain what has been told to retain. Okay. Low load deflection rate is desired for spring. We just understood this. Springs, open coil spring or closed coil spring, they should have a low load deflection rate, because otherwise we will have to apply a large amount of force or large amount of load to deflect it so that it can be inserted in between 2 teeth. Okay. Next, wires should be ductile. So we read about ductility and malleability, ability to beat it into thin sheets or draw it into thin sheets and this wires. So that was ductility and malleability, which was covered in our second video. Ease of forming, meaning formability concept. Remember we read about formability, the wires should be formable so that desired shapes can be given. So that is ease of forming. Next, ease of joining. So we saw joinability. There were 2 things, soldering and welding. This is the thing. The ideal requisite, it should be heat treatable. When I'm talking about heat treatability, you should be able to click it that we read about heat treatment, high heat treatment, low heat treatment, that is annealing and tempering. This is the concept. Should have resistance to corrosion, definitely biocompatibility. So this is there. Should be stable in the oral environment. Yes, it has to be stable. It should not be allergic. It should be non-allergic. It should be non-toxic. It should be resistant to corrosion, and it should be a poor biohost. It should be biocompatible. Done. It should be cold workable. Again, cold workability. Remember the thing which you do in your BDS years, straightening a wire, strain hardening. We read that. So that is your cold workable. Wire should have sufficient strength to withstand the forces applied on it. Again, we read the concept of strength and stiffness. That was the amount of force required to activate the wire and to deform the wire. Okay, so just mugging up the ideal requisites is one thing, and understanding each and every point in depth is another thing. And we have done the second thing. So whenever you're talking about ideal requisites, you don't need to mug it up, first thing. Second, each and every point is understood by you now. Okay, I did not give this slide at the very first go on purpose, because then all the students, they are like ideal requisites is an easy thing. We can always mug it up and remember. But no, that is not the purpose. That is not how you can solve an MCQ. Mugging up will never help you solve MCQs. If you want to solve MCQs and get the correct answers in your NEET MDS examination, the basics have to be thorough. Your theory has to be crystal clear. Okay, So basically we were covering all the ideal requisites one by one under the topic of basic concepts of basic properties of orthodontic archwires. So yes, this is what has been done. So all your basics are covered. Now whatever we'll be doing in the coming up lectures, it will become very easy for you people to understand it.